other work I do, so the last few years I've been working on ethical issues in relation to AI, but also actually work which sounds completely different, but is actually really complementary. So I've been working with a team of medical sociologists who do ethnographic work in hospital wards, looking at investigating the care of people who are in ordinary hospital wards, but who also have dementia.
Well, you're going to have to tell us about that. You can't leave me hanging.
Okay, yeah. So this is actually there's a book that you can really plug. But my colleague Katie Featherstone, who leads the project, whose work is absolutely brilliant, she's so great. Actually wrote with somebody else on the project, Andy Northcutt. They're the people who've been going into the wards and doing this ethnographic observation. So just like in any case, any listeners don't know what ethnography is, it's basically when you hang around people for a long time, sort of get used to you being there and just kind of like observing what's going on. So they do a form of ethnography which is called Symbolic Interactionism, which is focused on not in doing things like counting the number of times a patient did so and so, but on trying to understand the meaning of the interactions going on in the social world, in the social world of a ward. So the book which they published a few months ago, last year or earlier on this year, is available free because it's open access book, so you can download it for free on Amazon. It's called Wandering the Wards. So they've got a whole host of really fascinating material about what they found and how they analysed the results. So we're still carrying on with this work. And actually, one of the things that I hope to be doing is actually then jointly with them is to writing up I mean, I think the book is very accessible actually, but a more accessible book because this is a topic that is of interest to so many people. So many people experience dementia. So many people would have a loved one in the family with dementia. There's so many interesting findings in relation to how dehumanizing can happen, and it's all unintentional. It's all unintentional because you say, but one of the problems is that actually one of their concerns is the pressures on the staff as well. Oh yeah, that's it.
Keep talking.
Yep. Wandering
so there we go. If you can download it free.
Yeah, it's free.
But do keep talking, Doctor.
Yeah, and actually they also got a website, Stories of Dementia. So I think the website hasn't been updated for a little while, but there's a website actually has got some. We've done some sessions of artworks with people living with dementia, doing artworks expressing aspects of their experience in hospital. So there's some really interesting interviews as well. So in terms of dehumanization, how the sorts of dehumanization happens, the book's called Wandering the Wards because that was such a dominant theme from their research that when people who were living with dementia, or actually sometimes people who didn't have dementia but were thought to have dementia, were trying to walk. No, maybe they're trying to wander the wards because they're looking for their handbag that's got lost, or because they're trying to get to the toilet, for instance. The behaviour was very likely to be seen as just wandering, seen to be aimless, because there's a sense in which dementia is a very variable disease, because there's different forms of dementia, and it depends on which area of the brain it's mostly impacting. And it also depends upon things like the time of day, and also if you're under stress. So that somebody who maybe have mild dementia, who may be able to live happily at home with their spouse or maybe independently, the stress of suddenly finding yourself in a different place, in a hospital ward, and you're not there for fun, you're there because you've got a urinary tract infection or you've broken your hip or something. But that can mean that you find things even more difficult, even more confusing than usual. So things you would ordinarily manage, you can no longer manage very well, or you need a bit of extra help. A lot of the dehumanizing happens because of the demands of a timetable of the ward. So that then you can get a cascading impact. So in general terms, so to put a bit of context, between 1/4 and 1/2 of all patients on acute hospital wards have a dementia diagnosis. So we're talking a really, really large proportion of people on hospitals. So it's a really, really major issue. So
Yeah.
the hospitals obviously have got to be run in a certain way, very certain timetables. But what's known is that people admitted to a hospital ward with a certain condition, if you also have dementia, your outcomes are going to be much worse than if you've got the same condition, the same age, but no dementia. And we see a rapid decline, often a rapid decline of capacity, people often losing capacities. So there are all sorts of ways in which things are happening on the hospital ward, which are like nobody's fault, but we didn't find any instances of the staff behaving badly. It's how the system has unintended consequences. So let's just talk about maybe two or three of things that's happening. So one of the things that the hospital all the hospital wards quite rightly are trying to prevent falls in patients, especially in older patients, because if you fall, then the older you are, the more likely you are to have a fracture, and if you have a fracture, then that's got more serious results. The older you are, the more serious it is. So they're trying to prevent falls, and it's got to be recorded in the system. So any fall is like a major incident. So there would be a major investigation as to how a fall happened. So there are lots of steps taken to prevent people from falling, and a lot of those steps involve thinking that people shouldn't be leaving their beds. So they shouldn't be going to the toilet, or they should wait. They should wait to go to the toilet until someone's come to take them to the toilet. Well, maybe if you weren't ill and if you weren't 85, you could wait. But maybe your bladder control is fine as long as you can go to the toilet when you want to.
Yeah.
If you've got half an hour, it's gonna be a bit of a strain. But so because people might be seen to be, they shouldn't be doing that. You should stay in bed. You shouldn't be doing that. And if they're walking around looking for stuff, their behaviour is seen to be an indication of dementia, because it's not seen to be done with a reason. They're just wandering. It's aimless wandering. Well, they might be a reason for it. Maybe they just want to stretch their legs. Maybe they're bored. Maybe they want to go and look out of a window. But so again, this is not something. Again, this is like a general finding. So that your behaviour is actually interpreted as being a sign of the condition, and therefore you get a cascading idea. So, but also one of the problems of trying to prevent people from walking in case they fall is that you can have really rapid deconditioning. So I don't know if you've ever been ill, but if you have the experience of, like, I've often had flu really badly, spent a week in bed, and you get up and your legs are all wobbly.
Yeah.
But the older you are, so if you're in your 80s and you spend a week in bed not moving, then you will decondition far more rapidly. So you'll, in other words, age really rapidly. So you really ought to be up and walking around insofar as you can. So it just escalates for deconditioning. Timetables on the ward. So things like the drugs round. So obviously it's incredibly important on the drugs round that no mistakes are made. It's really, really important that nobody gets given the wrong medication. And so I mean, often the nurses will be wearing a tabard saying, do not disturb, or something along those lines. But a lot of people a lot of older people admitted to hospital are on routine medications at home, and they get to hospital and they say, "Oh, the blue pill. What's this yellow one?" It may be the same pill, maybe it's a generic. The doctor might have changed the dose, so they're questioning it, or they don't want to take it, or it may be. It's very often the case that people have been prescribed medication by their GP, but they never take it because they know that upsets their digestion or something, or they take it. They know that if they take it at 4 o'clock, it's fine, and it's not. It's too early to take it now. So they'll be questioning the nurse who's trying to give it to them, and very often that will be interpreted as
a symptom of dementia. Yeah. Of course. You can look. You can.
It's not fun. So, but one of the other things that in terms of dehumanization. So actually, this going back to the question about continence pads really illustrates it. Of course, some people would really need to be in pads. It's just that's what they would need to. But one of the things that researchers found is that people who are living with dementia, but also older people in general, on the wards are much less likely to have any personal belongings on their cabinet. What's it called, by the side of their beds? What are they called? You know,
I know what you mean. Yeah. Why?
Yeah. What are they called? I knew.
Yeah.
Anyway.
Cabinet.
Yeah. Anyway, you know what I mean, don't you?
Dresser.
Yeah. So they're much less likely to have any get well cards and much less likely to have even like a wash bag or anything, and tied it away. And actually, often their possessions get lost. False teeth go missing, glasses go missing. You wouldn't believe it. But also much more likely to be dressed in hospital gowns, hospital pajamas or hospital gowns, and often really not the right size. So I remember describing one of the incidents. I was describing an elderly gentleman who was in a hospital gown with a really low cut V at the front. It was too big for him, so most of his chest was exposed, and he kept on kind of like clawing at the material. So obviously distressed at the fact that he's not the sort of person who normally has complete strangers seeing his hairy chest. So it was bad enough being in hospital. It's even worse. But if you could imagine, say an elderly person who's like maybe in one of those awful backless fronts or a flimsy pair of hospital pajamas with a big continence pad on, trying to get to the toilet. Everybody can see that this person is all the work on all the social science research on dehumanization says the dangers of uniforms. But also these are uniforms which indicate low status. A doctor in a white gown is a high status. These are uniforms that give you like real bottom of the pile status. But in addition, so and again, none of this is conscious. No one is consciously.
No. And there's nothing sinister going on here. There's nothing sinister.
Yeah, but in addition, for somebody with dementia, actually this gets back to what's wrong with the accounts of personhood, which stress cognitive capacity and verbal capacity so strongly, is that there's a lot of evidence that a lot of people with dementia retain a lot of capacity, but maybe it's the verbal capacity and what we would clearly see as more typically see as cognitive capacity, but they maybe have difficulties with, but they have a sense, a felt sense of who they are socially that's weakened really severely. Weakened if familiar clothing is taken away. So we've drawn on some really interesting research by a Canadian researcher, Pia Contis, who's done a lot of similar work looking at people living with dementia, for example, in care homes, and again pointing out that behaviour which seems irrational, or people who seem to have lost a huge amount of capacity, have actually retained a lot of capacity in terms of their social standing and awareness of where they are in a social world. So, for example, she describes residents in a particular care home where people, were wearing their own clothes. You would think with advanced dementia would no longer have the capacity to sort of really see themselves as a person. So, but she sort of describes, for example, a lady walking along with a Zimmer frame to get to the dining room, stopping to look in a mirror and adjust her lipstick. So she's fully aware of how she sees herself. So that for a person with dementia to be taken out of their familiar clothing and put in hospital clothing is going to actually worsen the condition. If they were in their own clothing, they would have a sense of familiarity, they'd know where they were. It would actually helps their memories and helps their sense of self and what's actually going on.
Oh, of course. And and that's just the basic things. And when you add I've seen them been in emergency wards a lot, and you see how busy they are with, they get no sleep.
Yes.
People get no sleep. They don't get the food, really basic stuff like that. Wow.